Hello guys, today we are going to review major organs and organ systems: circulatory, respiratory, digestive, nervous, skeletal, muscular, urinary, reproductive, endocrine, and integumentary. We have the circulatory system, which is the transportation system. It transports oxygen, nutrients, waste materials, and hormones. We have the heart as the main organ with its two atriums and two ventricles. This is basically how it works. We have arteries taking oxygenated blood and vein taking unoxygenated blood back to the heart. This is the whole cycle. We get unoxygenated blood to the right atrium, from the right atrium to the right ventricle, from the right ventricle to the lungs, and through the pulmonary artery. This is the only artery in the body that has unoxygenated blood. Then we get the oxygen, comes back through the pulmonary vein again. Pulmonary vein is the only vein that has oxygenated blood in it, and we land on the left atrium. From the left atrium, we go through the left ventricle, and from the left ventricle, we go to the rest of the body. Now, we have the aorta, which is our biggest artery, and it has a thoracic part and an abdominal part. And in the thoracic part, uh, it has some branches, and most important ones are carotid arteries. These take blood to the head, and then subclavian arteries that become the brachial artery. This is the main artery of your arm. It then breaks down into other smaller ones, and then we have the veins coming back. We have the basilic vein, and those basilic vein becomes the superior vena cava here, going to the right atrium. Now, for the lower part of your body, or the abdomen, we have the abdominal part of the aorta, and we have the hepatic artery going to the liver, the gastric artery, stomach, renal arteries going to the kidneys, and then it divides into iliac arteries, and these are the ones that irrigate the legs. Now, coming back from the legs, we have the iliac vein. They become the inferior vena cava over here, and that vena cava irrigates, also, well, picks up the blood from the kidneys, and we have renal veins. It picks up blood from the stomach. We have the gastric vein, and then it goes right back to that atrium. Now, these are the cells we have on our blood system. We have erythrocytes, platelets, and white blood cells. Erythrocytes are the red blood cells. They carry oxygen. Platelets, they do clots, and white blood cells protect our body. Now, we have several kinds of white blood cells, and I'm going to go through them real quick. Basophils here are in charge of inflammation reaction and histamine. Neutrophils are in charge of bacteria and fungi. Eosinophils are in charge of large parasites and allergic reactions. Monocytes are the ones that eat everything that is not supposed to be there, like strange bodies or decomposed tissue. And lymphocytes are the ones that attack whatever is not supposed to be in our body. And we have several kinds of lymphocytes. We have B cells that release antibodies, and we have T cells that are kind of like the attacking white blood cells. There are several kinds of those: CD4, CD8, and natural killers. Okay, we also have the spleen. The spleen is an organ in the upper far left part of the abdomen. It's where red blood cells are broken down, and it contains also platelets and white blood cells. Now we have the respiratory system, and we already saw this. We have the nasal cavity, oral cavity, the pharynx with nasal pharynx and oropharynx. Then we have the larynx. We have the epiglottis there. That's its job is to block the larynx and the trachea when we're swallowing. We have the trachea, then bronchi, bronchioles, and lungs. Right lung has upper, middle, and lower lobe. Left lung has upper and lower. This, you can see a major division of the trachea. couldn't be seen over here because it was covered by the heart. So here we have the trachea, the bronchi, and bronchioles. Bronchioles, we have obviously we have lobar bronchioles going to each lobe, and they're called the same thing: superior, inferior, middle, and superior and inferior here. Then we have the digestive system, where we process our meals, and it basically starts in the oral cavity. We have lips, gums, teeth, hard palate, soft palate, uvula, and tongue. Now the soft palate and uvula, they work together to close the nasopharynx to prevent food from entering the nasal cavity. After that, we have the pharynx and the esophagus with its upper esophageal sphincter and lower esophageal sphincter. Then we have the stomach. It's made up of several layers of muscles, smooth muscle, and this is where we produce acid, and after the stomach, it goes through the pyloric sphincter here and to the duodenum. Now, stomach has a fundus, cardia, for the muscular layers. It has a longitudinal layer, circular, oblique, and we have here the mucosa. After that, when food is on the duodenum, we have some participation of the liver, gallbladder, and pancreas, releasing enzymes to the duodenum. This over here you can see is the main cells of the functional units of the pancreas is the Langerhans islet, and it's where its hormones are produced and enzymes. After that, we have, well, the small intestine with its three parts. We have the duodenum, the jejunum, and ileum, and all of that goes through the ileocecal valve through the colon. After the ileocecal valve, we have the appendix, the cecum. Here it's this part under the ileocecal valve of the colon. Then we have the ascending colon, the transverse colon, the descending colon, sigmoid colon, rectum, and anus, and that's how we process food. Then we have the nervous system. Nervous system consists on brain, spinal cord, and nerves. We divided mainly into a central nervous system with a brain and spinal cord, and peripheral nervous system, which is our nerves. Also, central nervous system is covered by the meninges. Meninges are these three layers: the dura mater, arachnoid mater, and pia mater. These is how the spinal cord is divided. We have cervical nerves, thoracic nerves, and they're all numbered. What they do is, well, they nerve the neck and head structures. We have cranial nerves or cranial pairs as well that innerve the structures of our head. We have the brachial plexus. It goes to the arms, and underneath here we have the cauda equina. This is where all the nerves for the lower limbs originate. And we have nerves. We have motor nerves and sensitive nerves. The main ones we need to know about in the upper extremities is the radial nerve, median nerve, and ulnar, and that's it. So radial, median, and ulnar, those are the three we need to learn on the upper extremities. On the lower extremities, the main one we're going to hear about is the sciatic nerve. It's pretty uncommon to hear a provider or an LEP mention one of the others. Now, skeletal system, we have the skull. Skull is main function is to protect the brain, of course, and it's made of frontal bone, parietal bone, occipital bone, and temporal bone here. It also is made of other smaller bones like the ethmoid, nasal, lacrimal, zygomatic, and this is what they do is basically create the structures around the eyes, the maxillary here, on the upper part of the mouth, you could say. Mandible would be the lower part. Now we have the spine. Spine is made up of vertebrae. We number those vertebrae, and the first two are special. They're called atlas and axis. These are the divisions. We have cervical spine, thoracic, lumbar vertebrae, then sacrum and coccyx. This is the first two, atlas and axis. They are different in structure because this is where the skull lays, and that's our joint over there. Here we have the sacrum and coccyx. The sacrum is also made of several vertebrae, but they're fused, and so is the coccyx. Now this is the rib. The ribs are, well, this is just the thoracic cavity, or rib cage. Rib cage would be actually the better term. We have ribs, and we have the sternum here. On the back we have the vertebrae or the spine. After the ribs we have 10 true ribs, and then we have false ribs or floating ribs, 11 and 12. That's because they are not joined to the sternum. The sternum is made up of 3 parts: manubrium, body, and the xiphoid process, which is this little tip over here. Then main bones of the upper limbs are the clavicles, scapula on the back. Then we have the humerus, ulna, radius, and then our hands we have the carpal bones. We have carpal, metacarpal, and then the phalanges. We have proximal, middle, distal. Phalanges are the fingers basically. On the lower part of our body we have the pelvic girdle. This is right and left hip. They're actually made of other bones, but we are never gonna hear them as interpreters. It would be pretty rare. So what we need is right hip, left hip, and then that joins to the femur. We have the hip bones there, then the femur, the patella, which is the bone on the knee. We have tibia and fibula, and just as the carpal in the hands, we have tarsal on the feet. So we have tarsal, metatarsal bones, and then the phalanges. Again, we have proximal, middle, and distal phalanges. Those are the toes. These are the types of joints we have. We have ball and socket joints. These are our hip joints and shoulders. We have condyloid joint. These are our wrists and ankles. We have plane joints and saddle joints. These two, we find them in the carpal and tarsal areas. We have the hinge joint. We find that in our elbows and knees. And we have the pivot joint, which is our skull and neck joint. Now we have the muscular system. Muscular system is main function is motion. It also provides heat, and these are the main muscles we need to know as interpreters. We're going to hear about deltoids, pectorals, abdominals, obliques sometimes, not here, but obliques we're also going to hear them from time to time. Quadriceps, trapezius in the back, latissimus dorsi, gluteal muscles, hamstrings, and gastrocnemius. On the arm, we're gonna have the biceps, triceps. Muscle have tendons joining them to bones. Not all of them. Like muscles on the tongue, for example, we have 4 muscles on the tongues that are called intrinsic muscles of the tongue. tongue is made up of muscles, and they don't join to any bone. The urinary system, it's part of the excretory system. The thing is, excretory system has a lot of other different systems with it. It includes some part of the respiratory system because we excrete CO2 and gases. It includes some parts of the digestive system, obviously. It includes parts of the integumentary system because we also excrete some substances on our skin. Now we're gonna address the urinary system on its own. Main organ is the kidney. Kidney has a cortex and medulla. In the medulla we have the pyramids. This is where the filtration takes place. Whatever is filtered goes to the calyces. So we have minor calyces and then major calyces. Major calyces come together and form the ureter. Now the ureter takes urine from the kidney to the urinary bladder. From the urinary bladder, we have the urethra. On women, urethra is much shorter than on men, and this is just for you to see where everything is located. We have the bladder and urethra on the most frontal part, then the uterus and vagina, and on the most back posterior part, we have rectum and anus. This is the same thing on male. We have the urinary bladder and the urethra, longer urethra. Thing is, the prostate is here, and that is why elderly men may have trouble urinating sometimes if the prostate is enlarged. Now, reproductive system. Male reproductive system, we have two exterior structures. We have the penis and the scrotum. Now, inner structures are testes, the epididymis. This is for production of spermatozoids. Then we have the vas deferens that take those to where they need to go. We have the seminal vesicle making seminal fluid, and whatever is produced here and here makes up the semen. Now we have the prostate gland over here and the urethra, and that's how semen gets outside. Penis has a root, body, and glands here, and the feminine or female reproductive system, we have the ovaries, fallopian tubes. This is where the ovule travels, and this is actually where the spermatozoid and ovule come together, kind of like over here, and then they travel together to get implanted on the uterus. So uterus, we have the endometrium, which is the inner lining of the uterus. Then we have the cervix and vagina. Now this here is a quick view of the menstrual cycle. It has a ovarian cycle over here and an endometrial cycle over here. This happens in the ovaries, this happens in the uterus. The endometrium, as we said, is the inner lining of the uterus. It has it's divided in two, in a functional layer and a basal layer. The basal is the darker word you can see over here. So what happens? First, we have the FSH. This is the follicle stimulating hormone, and it stimulates the development of this follicle over here. The yellow part here is called an oocyte. It's an immature ovule. While that's happening, we have estrogen increasing levels, and that makes these over here grow. The endometrial layer grows and thickens. Around day 14, we have a peak on luteinizing hormone, or LH, that releases the ovule, and that's ready to be inseminated. Then we have what is left of the follicle is called corpus luteus, and what the corpus luteum, yeah, corpus luteum does, it produces progesterone. That progesterone helps thicken and maintain this endometrial layer, and after um, these days it gets it breaks down. Then we have a drop on the progesterone production, and these over here begins to be broken down, and that's where menstruation happens, and all this layer is shedded, and then the cycle starts over. Now we have the endocrine system. This is made up of glands that produce and secrete hormones. These hormones, what they do is they regulate body's growth, metabolism, our sexual development and function. We have here the pineal gland, pituitary, hypothalamus, thyroid and parathyroid, thymus, pancreas, adrenal glands, testes, ovaries, and placenta during pregnancy. These are some of the hormones produced by those glands, and we don't have to learn them all, so don't worry. But there are some that we are going to hear about. We are going to hear about melatonin. We are going to hear about prolactin. We are going to hear about insulin. Then androgen, maybe a little bit about adrenaline and noradrenaline, and T3 and T4. We're gonna hear about those on patients that are have some type of thyroid affection, and we are going to hear about dopamine and vasopressin. Not so much the other ones. It would be kind of rare for those to be mentioned. They can be, so we are going to address most of them on our class on the endocrine system. But this is for you to know just the organs and major systems, so we are going to carry on. Finally, we have the integumentary system. This consists of skin, hair, and nails. This is a protection system. It basically protects us from the outer environment. So skin, which is our largest organ, actually, it has a total area of about 20 square feet. This is the largest and heaviest organ. It's around 15% of our body weight, and it has 3 layers: the subcutaneous layer, the dermis, and the epidermis. The subcutaneous layer has fat tissue and connective tissue. The dermis has on the subcutaneous layer, that's where the blood vessels travel and nerves. Then on the dermis, we have the hair follicles with the sebaceous glands over here, the sweat glands. Every hair follicle has a small muscle called erector pili muscle that erects the hair. For example, when we get goosebumps, that hairs come straighten, and that's because of that muscle. And we also have sensory receptors on the dermis, receptors for touch, heat, pressure, pain, etc. So the outermost layer is the epidermis. These are all basically dead cells already that we shed, and the hair. So it's the what we see. This is the basic structure of a hair follicle. We have the dermal papilla. This is where it's kind of its root, let's say. This would be the hair root. This is where hair is produced and it grows out. And as I said, all hair follicles have a sebaceous gland and their erector pili muscle. Here we have the nail. The nail has the nail edge. Then we have the nail plate and the lunula, which is this moon-shaped white area. When we have the cuticles and proximal nail folds. That is basically it. Now, thank you for paying attention through the whole video. If there's something that I didn't mention that you would like to know, because as I said, it was just a review of this was just for you to review the organs, then let me know. If there's something else that you want to expand or know more about, and I will gladly take care of whatever your doubt or concern is. See you next class. Bye bye, guys.